Hello, I'm Dr. Joseph Cerna, and I'm a general practitioner located in Southern California, and I'm here to talk about chronic fatigue syndrome, fibromyalgia, and restless leg syndrome. It's quite possible that you've clicked on because you've been diagnosed with having this problem, or you suspect that you might have it. Either way, I'm sure that this clip will be of enormous benefit and useful to all of you. For starters, patients who show up in my office with these problems complain of achiness of the body, neck, pectoral, deltoid, arm, shoulder blade, calf, leg. The interesting thing is that the achiness usually is of the left side of the body, more than the right. In addition, they complain of anxiety and depression, inability to concentrate, forgetfulness, sleep disturbances, foggy-mindedness. Some years ago we did quite a few MRIs on patients, and we found viral encephalitis in the thalamus, which might explain the thalamic pain and the anxiety and depression. The patient symptoms increase on exertion, working out, having sex, and drinking alcohol. And this, very important and very interestingly enough, and very key, is probably due to the leukopenia that we found in quite a few of these patients. The leukopenia meaning that the white blood cells, which are responsible for the infections, are lower than they should be. This leads one to assume that there's a bacteremia and the possibility that this low-grade fever, which many of these patients have, and the night sweats are due to the bacteria in the blood, which should not be there. These patients would end up receiving antibiotics depending upon where the site of suspected infection was, or bacterial overgrowth, normal bacteria which shouldn't be there in such large amounts. So these patients have chronic pharyngitis, which are painless, along with bronchitis and asthmas, and women have uterine infections, or I should say uterine overgrowth of bacteria, which causes the irregular menstrual periods, low back pain, and the achiness with periods. So I'm not an advocate for any laboratory pharmaceutical company, but I must say that levaquin augmentin and effective served me well. Upon receiving any one of these antibiotics, the symptoms subsided very much, and the sense of well-being returned, the achiness decreased, the foggy-mindedness also decreased, only to recur with the cessation of the treatment. So what to do? Left with compromised patients, the next step was to try 10,000 milligrams of vitamin C. This was advocated by Dr. Linus Pauling, two-time Nobel Prize winner. It helped out very much, and it caused no problems with any patients. And also, taking into consideration that alcoholics have problems with encephalitis and neuritis, and thiamine is used to assist in the recovery of the nerves, that also was tried, and I ended up using over-the-counter vitamin B complex 100 in large amounts. This also helped very much. Also taking into consideration that burn patients require more protein than the regular diet, I also requested that my patients take larger amounts of protein. This also improved. So vitamin C, B, protein helped, also zinc, along with stretching of the affected areas without any physical exertion during 3 or 4 weeks. And all this put together helped out very, very much. So the patients improved much quicker than patients not using this type of medication. Everything I've mentioned here should be corroborated with your doctor, and I cannot tell the viewer or emphasize enough to the viewer not to take this treatment without consulting your own physician. If there's anything I may be of assistance to you, you can locate me in area code 714-545-5503. 714-545-5503. I hope you do well and recover, and do talk to your physician. I cannot recommend this to you. It has worked for us. Thank you.